So these are some NCLEX style practice questions that I actually posted on Instagram within the last week or two. One of them is not. That's going to be the last one that we do. But the first two are. And like I promised to my Instagram followers and to those that follow me on my website or that just communicate with me through my tutoring service, I wanted to do something where I could post just a few questions at least once or twice a week. Really, my goal is twice a week. That way, you know, the random questions, we work through them. You can see how I rationalize through them. And it's really because a lot of the requests, again, that I get are for how to answer questions, just how to read them, how to interpret them, how to answer them. So just by kind of, you know, coming in once in a while, checking out these videos, seeing how I work through questions, it's something that you can take with you when you're in the classroom or even when you're testing at the actual NCLEX. So let's look at some of the questions that we did. This was one that I posted this week. Now it says, a client has experienced a near drowning event in salt water. The nurse anticipates that the client may experience which complication of this trauma? We have A, heart block, B, renal failure, C, pulmonary edema, D, respiratory alkalosis. Now, what I always recommend is read the question twice. So I read the question to myself the first time, just as I did out loud. And the second time, I'm going to underline what's important in this question, so the key points. So if you're someone that likes to underline or circle or put boxes around your words, I recommend that you do that. So go back the second time and do that. So a client has experienced a near drowning event in salt water. So here's my important points. I'm going to underline this because I want to focus on it. The nurse anticipates that the client may experience which complication of this trauma? So I'm going to anticipate something. I'm anticipating a complication. So my question now for me becomes near drowning event in salt water, anticipating a complication. So what should we always do? First thing with every question, think expected outcomes. You hear me say it all the time, and you hear me, or you read me write it rather, on Instagram. Think expected outcomes. Based off of the scenario and the information that you have, what is the expected outcome? Now, this is not the same thing as assuming and adding to the question. No, this is actually intelligent intuition, critical thinking. What do you expect based off of this? So the things that I'm thinking about in this scenario, I know in a near drowning, right? Expected outcomes, aspiration. I know I've got salt water coming in. I know my issue is respiratory, right? Because you're thinking about a near drowning client. Let me just make sure I spell this right, respiratory. You're thinking about a near drowning patient, right? What's the expected outcome? Someone submerged in water, they're going to aspirate the water because at some point we know that the person takes a breath. It's inevitable. They're going to breathe. It's an involuntary action. So that means I am anticipating my expected outcome that this patient is going to aspirate salt water. That means that they're going to inhale or breathe in salt water into their lungs. So the first thing I'm thinking about is a respiratory issue. That's where I should be going. Now, if I look at my options, heart block. What does heart block have to do with a near drowning event in salt water? It's not related. If you're thinking, well, if they ingest too much salt, it can, affect the cardiac rhythm, too much sodium. Perhaps, but is that the first thing that I anticipate is going to happen? No. Renal failure, we know that this could definitely be possible from ingesting too much salt, right? Too much salt water, rather. But is this going to happen immediately? Is this, again, my first thing that I'm thinking of? Definitely not. Remember, I was thinking about respiratory, right? Well, here's pulmonary edema. And pulmonary edema, I'm thinking that sounds really good because I know that the client's going to aspirate salt water into their lungs. And I know that where salt goes, water follows. And that would be my edema, right? And this makes sense. I'm going to aspirate salt water into my lungs. It's going to cause fluid shifting. So I like this. I'm going to leave it alone. Now, respiratory alkalosis. Could this be a possibility secondary to aspirating or ingesting salt water? Certainly, but is this a complication that I'm thinking of that's going to happen now? No. Remember, I know that I was dealing with something respiratory, so I'd be left with C and D, thinking about respiratory issues. But what would I anticipate to happen in this near drowning? I would anticipate that the first complication that's going to occur here is going to be pulmonary edema. And that is actually our answer. Okay? So I'm going to delete this, and let's look at our second question. So we have a 56-year-old client reports to the nurse that his sleep patterns are different than when he was younger. The nurse anticipates that this client is likely to be experiencing which normal developmental pattern? A, 6 to 8 hours of sleep per night with about 20 to 25% of rapid eye movement, or REM, sleep, and a marked decrease in stage 4 non-REM, or NREM, sleep. B, 6 to 8 hours of sleep per night with about 20% REM sleep and a decrease in stage 4 NREM sleep, or non-REM sleep. C, erratic sleep because of work schedule with about 30% of REM sleep and no marked decrease in stage 4 NREM sleep. D, light sleep with equal amounts of REM sleep and NREM sleep, or non-REM or NREM, however you like to say that. So this question I actually posted on Instagram, and so many of you were like, what the heck? I have no idea. Because let's face it, in nursing school, one of the last things that we're going to remember is our REM sleep and our non-REM sleep. So this is a good question, and I did this purposely because I anticipated that not a lot of people are just going to, off the top of their head, remember REM and non-REM. And I wanted you to work with this question just to practice the skill of answering a question when you don't know the answer, when you really feel like you don't know what's happening. How can we figure out the right answer? Well, you can, and this is a good scenario. So I'm going to read it again. Remember, second time underlining what's important. So a 56-year-old client reports to the nurse that his sleep patterns are different than when he was younger. So I have 56-year-old client. He's got sleep patterns are different than when he was younger. Okay. The nurse anticipates that the client is likely to be experiencing which normal developmental pattern? So I'm looking for the normal, and that's an important part. Don't forget about that. I'm looking for a normal developmental pattern in this 56-year-old client. So something that's different now than when he was younger, but it's a normal developmental pattern. So let's say I have no idea. I don't remember REM. I don't remember non-REM. I don't know what's going on. So how can I figure these out? How can I eliminate some options? So this first thing says 6 to 8 hours of sleep per night with about 20 to 25% of rapid eye movement and a marked decrease in stage 4 non-rapid eye movement. Okay, so far I don't know what that really means. I'm just going to leave it there, right? This is me pretending like I'm the student. 6 to 8 hours of sleep per night with about 20% REM sleep and a decrease in stage 4 non-REM sleep. Well, now I see that this and this are the same, right? So it sounds like A kind of looks like B, but let's come back to that. Let's see if we can keep eliminating. C, erratic sleep because of work schedule with about 30% of REM sleep and no marked decrease in stage 4 non-REM sleep. So there's something in this option that I really don't like. Let's look at D, light sleep with equal amounts of REM sleep and non-REM sleep. So if I come back to A and I look at A and B, these look really similar to me. This has 6 to 8 hours of sleep per night with about 20 to 25% of rapid eye movement sleep. This says 6 to 8 hours of sleep per night with about 20% of rapid eye movement. These two statements are just about the same. And then I see a marked decrease in stage 4 non-REM sleep. And this says a decrease in stage 4 non-REM sleep. Well, folks, these are pretty much saying the same thing. Now, I want you to recognize that when you are doing these NCLEX style questions, whether you're testing in class or you're checking the actual test, When you see two options that are extremely similar in description, or that they are saying the same things with maybe just a slight change in words, get rid of them. Get rid of it. So now I'm left with C and D. Erratic sleep because of work schedule with about 30% of REM sleep and no marked decrease in stage 4 non-REM sleep. Erratic sleep because of work schedule. So work schedule. Think what? Expected outcomes. And excuse my sloppy writing. Expected outcomes. Do I expect this 56-year-old client to have a work schedule that's going to cause erratic sleep? No, that's not an expected outcome for this client. I don't like that, so I'm going to get rid of that. That doesn't sound like an expected outcome for a 56-year-old client. Now, how about light sleep with equal amounts of REM and non-REM sleep? Well, 1, this is the only option I'm left with, and D is the correct answer. And this sounds like a normal developmental pattern. At 56, light sleeper, equal amounts of sleep. Now, I got rid of this work schedule, 1, because there's no information in this question that says anything about this client's work schedule. And I don't expected outcomes based off of just the developmental knowledge that we know that a 56-year-old client is going to have an erratic work schedule. So that's how we get rid of this question. So this is a good example of how just to work your way through a question when you really feel like I have no idea what's happening. So let's delete this and look at our next one. Now, the nurse is caring for a client who is recovering from partial thickness burns. Which choice of breakfast items indicates the client understands the recommended diet? 2 slices of toast with butter, orange juice, skim milk, 2 poached eggs, hash brown potatoes, whole milk, 3 pancakes with syrup, 2 slices of bacon, apple juice, 1 cup of oatmeal with skim milk, half grapefruit, and coffee. So with everything, you're going to be tired of hearing me say it. Think what? Expected outcomes. What do we intelligently know, right? Our critical thinking. So again, second time, I'm caring for a client who's recovering from partial thickness burns. And I want to know that the client understands the recommended diet. So this now becomes my question. I'm looking for options that prove to me the client understands what they should be eating. And my client is a client recovering from partial thickness burns. So if I'm thinking expected outcomes, I know what does this client need to be eating when they're in the recovery stage. What are we thinking, guys? Protein, right? Protein for tissue healing, for wound recovery. I'm thinking about protein. You may be thinking to yourself, well, they're going to need lots of vitamins, right? Vitamins and minerals to help rebuild that tissue. So that's good. But the big thing we have to think about expected outcomes, right, is that this person in the recovery phase is going to need a lot of protein. So that's what I'm looking for in this question. Now, this question in particular, like many NCLEX style questions that have multiple options in each A, B, C, and D, if the whole thing is not correct, if they're all not right, then the whole option's not right. You have to get rid of it. So we're focused on protein, right? We know that's what the client needs in this stage. So 2 slices of toast with butter, orange juice, skim milk. So if I'm looking for a protein, I might say that I can find a little bit of protein in the skim milk, but the orange juice is only going to give me vitamin C, so I'll just put VC. 2 slices of toast with butter, I mean, that's really just giving me some carbohydrates, right? But that's not all right. I only have 1 protein there. 2 poached eggs, hash brown potatoes, whole milk. Well, eggs have proteins, potatoes have protein, and whole milk, it's got protein. How about this? 3 pancakes with syrup, 2 slices of bacon, apple juice. Well, this is really carbs, sugar, right? Try not to write over the words. Here's my protein. Apple juice, maybe you're thinking, oh, we get a little vitamin C in there. And how about this? 1 cup of oatmeal with skim milk. Well, here's a little bit of protein here. Half a grapefruit, thinking vitamin. And coffee, that's not really giving us anything, right? So which one has an option that all of the included foods have the protein? B, right? Because A, C, and D, they're not all correct for this patient. So the correct answer is B. So I hope that this helps you. I hope that you're able to look at these questions, see how I rationalize through them, and practice that. Take the same type of technique that I'm showing you, that I'm giving you, and apply it. Do some practice questions at home. Pull out your book, pull out an NCLEX study guide book, any one that you have, pull out your textbooks from class, and practice working through these questions. Find out what the question's asking you. Look for the key words and eliminate the options that you know aren't there. Always think about expected outcomes, okay? Okay, so I will see you again on the next one.